คะพูดเลยได้ยินอยู่
yeah
ไม่มีไมค์ ไม่มีไมค์ค่ะอาจารย์จ้า
พี่มน
Okay, so I just like that's all right now that they can introduce themselves right now because most of them are at their office or some maybe at their classroom with students because some of them just like attend this conference from the classroom with students and some maybe from the office. I don't know, maybe we have like a วิทย์ได้ยินไหมวิทย์อยู่ไหมคะวิชชี่ Okay, so I just think that's all for our representative right now.
Okay, thank you, Dr. Chularat, for introducing of your lecture in BCN Thailand. Welcome, Mrs. Animai. She is our student, our lecture student, Stika Sang Tua Pekanbaru. Maybe you can introduce yourself, Mom Animai. Can you unmute your microphone?
Oh yeah.
Okay.
Hello, good afternoon. My
Good
name is
afternoon
Mrs.
too.
Animai, lecturer in Stika Sang Tua Pekanbaru.
Welcome to Zoom, ma'am.
Abah, Pak Dipa, Abah. Halo, Mrs. Animai. Nice to see you.
Hello, nice to see you too.
Mrs. Anime is last dean of our nursing program, and then now our dean is Mrs. Siska.
Pak Rasid, Pak Dipa udah ada perkenalan diri, Pak.
Oh iya.
Hello, Mr. Dipa. Mr. Dipa is one of our lecturer in medical surgical nursing. Maybe can you introduce yourself, Mr. Dipa, please?
Clinical instructor ya?
Yes, clinical instructor.
Okay, thank you, Mr. Rashid. Hello, everyone. Good afternoon. Assalamualaikum warahmatullahi wabarakatuh. I would like to introduce myself. My name is Diva Handra. You can call me Diva. I am clinical instructor at Stika Sang Tua Pekanbaru, and I am operating room nurse at Arifin Ahmad Hospital, Provinsi Riau.
Yeah.
Thank you,
Mr. Dipa.
Thank you.
Mr. Dipa is head
Mr.
of
Dipa.
nurse in operating theater in RSUD in Hospital Arifin Ahmad Pekanbaru Riau, Indonesia. Thank you, Mr. Dipa.
Okay.
Hello, Mrs. Siska. Can we start our event today?
Iya. How about Ajan Sularat? Ajan Sarinya? Can we start our event?
Okay.
Okay, we start right now. Thank you. MC, please.
Okay. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Sawadika. Good afternoon, ladies and gentlemen. Welcome to second online nursing conference collaboration program between BC and Surin Thailand and Stikes Hang Tuah Pekanbaru Indonesia. Honorable Chief of Stikes Hang Tuah Pekanbaru, Mr. Dr. Zainal Abidin, Master of Public Health, and Treasurer Mr. Marli Saleh. Honorable Head of Stikes Hang Tuah Pekanbaru, Mr. Ahmad Hanafi MKes. Honorable all speaker in guest lecture from nursing program of Stikes Hang Tuah Pekanbaru Indonesia and BCN Surin Thailand due to implementation of collaboration program of both institutions. My respect for all Vice Chairman of Stikes Hang Tuah Pekanbaru and Head of Collaboration Unit of Stikes Hang Tuah Pekanbaru Indonesia. Honorable Dean of Nursing Program of Stikes Hang Tuah Pekanbaru Indonesia and all of the lecturers. Honorable Dean Faculty of Nursing of BC and Surin Thailand and all of the lecturers. And dearest nursing student of Stikes Hang Tuah Pekanbaru Indonesia and BC and Surin Thailand. First for all, let praise to Allah Subhanahu wa Ta'ala for His blessing and mercy so we can attending and joining in this nursing conference. And also let us greet and pray to our beloved Prophet Muhammad Sallallahu Alaihi Wasallam who brought us to the path of light and left the darkness era by saying salawat. Allahumma sholli ala Muhammad wa ala ali Muhammad. Today is a great honor for us to be here and welcome to every one of you in this event. Okay, let's begin this opening ceremony by saying Basmalah. Bismillahirrahmanirrahim. Okay, before beginning this event, I want to remind all of the audience, please mute the microphone and turn on your camera during the meeting so that this event could running well and success without any obstacles. Ladies and gentlemen, next agenda is welcoming speech from Dean of Nursing Program of Stikes Hang Tuah Pekanbaru, Mrs. Siska Mayangsari MCAP. To Mrs. Siska, time is yours.
Okay, thank you, Ms. Meisa Daniati. Can you hear my voice clearly?
Yes, I
Yes, we
can.
can.
Okay. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone.
Waalaikumsalam warahmatullahi.
Good afternoon.
Sawadika.
สวัสดีค่ะ Good afternoon.
Honorable Chief. Yeah, thank you. Honorable Chief of Hang Tuah Pekanbaru Foundation, Mr. Dr. Zainal Abidin, and Master Public Health, and also the treasurers, Mr. Marli Saleh Esos, the Honorable of Head of Stikes Hang Tuah Pekanbaru, Mr. Ahmad Hanafi SKM MKes, Honorable all of Vice Chairman of Stikes Hang Tuah Pekanbaru, and also Head of Collaboration Unit of Stikes Hang Tuah Pekanbaru, Indonesia, the Honorable Dean of Faculty of Nursing of BCN Surin Thailand, and all of the lecturer and also clinical instructor, the Honorable all lecturer of nursing program of Stikes Hang Tuah Pekanbaru Indonesia, and also the clinical instructor, the Honorable, the prominent and professional speakers in guest academic lectures today, Dr. Sarinya Posinchan, who has expertise in adult nursing from Faculty of Nursing BCN Surin Thailand. Hello, Ajan. Good afternoon, Ajan.
สวัสดีค่ะ
Sawadika.
Nice to meet you. Nice to meet you.
Thank you. We are glad to having you today. And the second speaker is Mrs. Nurse Sandra MCAP, SPCAP MB from Nursing Program of Stikes Hang Tuah Pekanbaru. Actually, Mrs. Sandra was replacing Mrs. Rani Lisa Indra MCAP, SPCAP MB because Mrs. Rani has given a birth yesterday. So congratulations to Mrs. Rani. And of course, for all of my lovely students of Stikas Hang Tua Pekanbaru, Indonesia and BCN Surin, Thailand. Alhamdulillah Rabbil Alamin, thanks to our God who has given us chance and healthy. So we still can joining this event, second virtual event with great enthusiasm. And also let's greet our lovely Prophet Muhammad Sallallahu Alaihi Wasallam by saying Allahumma salli ala Muhammad wa ala ali Muhammad. Today, I still so delighted to see and to greet you, all of you, again by this second virtual meeting. And thank you very much for our audience who's already joining this Zoom meeting today. For our students and audience, in this second day, we will having the lectures about chronic kidney disease nursing care. This illness is commonly in every country in the world, include Indonesia and Thailand. So we are already having the prominent and professional speakers who will present the lesson. So for the students, please enjoy and please following the event all the time seriously. So it could make your comprehension about medical surgical nursing, especially about chronic kidney disease nursing care. Finally, thank you for joining this event. Enjoy all the time. Sorry for the inconvenience. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon. Sawadika.
Waalaikumsalam. Good afternoon too. Sawadika.
Thank you, Mrs. Siska, for the speech. Now, we going to welcome speech from Dean of Faculty of Nursing of BC Ansurin, will presented by Deputy Manager of Nursing in Faculty of Nursing BC Ansurin, Thailand, Mrs. Dr. Chularat Sainet Hauhan. Sorry, Ajan for misspelling. For Ajan, time is yours.
Thank you. Dean of Nursing Program of Psyche Hang to Pekanbaru, staff, students, and Deputy Director from Balomratchani College of Nursing Surin, our faculty members, staff, nursing students, and honorable guests. On behalf of the organizing team of the workshop, I'd like to take this opportunity to express our sincere thanks and appreciate to honor us with the presence over the second day of the workshop. พระบรมราชนก Institute for Health Workforce Development and the Association of Indonesian Nursing Education Center or INEX Indonesia recognize the benefits of developing a collegial relationship between our respective schools, between our representative school to exhibit strong international link. As Director Suchada Nimwatanakul mentioned on the first day of our online conference that this is a very great pleasure for Balomratchani College of Nursing Surin to have a memorandum of agreement on academic exchange program with the Psyche Hangtu Pekanbaru and under this MOU, there are lots of activity to promote a joint relationship between us, include exchange of teaching staff and researchers, exchange of students, exchange of academic information and publications, conducting reciprocal lectures and seminars, cooperating in research and the publication. And however, due to the COVID-19, we have discussed so for several times and have an agreement that we should launch our activities with online seminars. These online seminars aim at exchange knowledge in nursing, patients with mental health, patients with kidney disease, and nursing care during labor and delivery. And for today, the topic is about the nursing care for persons with kidney disease. So I would like to thank Ms. Sandra from Hangzhou Pekanbaru and Dr. Salinya Pon Singh Chan from Bolom Ratchani College of Nursing Surin for sharing their valuable knowledge and experience and make this conference success. Uh, on, on behalf of Bolom Ratchani College of Nursing Surin, Faculty of Nursing, Pabolom Ratchanok Institute, I wish to express my sincere thanks to Psyche Hangtu Pekanbaru for providing excellent representative and guest lecture and organize this conference and make this conference success. And it is my earnest belief that this is exciting bonds of friendship and cooperation between our two institutes, and we will be more foolish in the year ahead of our mutual benefits, in which I wish that we can continue in online conference like this, and other activity maybe we can add up for next year, such as research and other publication. So thank you very much for all of you to make this conference success.
Okay, thank you, Ajan, for the speech. Ladies and gentlemen, next agenda is photo session. Please give your good smile in the Zoom. We will take some picture from Zoom meeting. The photo session will guide by IT team by of Tikes Hang Tuah Pekanbaru. For Mr. Denny, please.
Okay, let I and Dr. Salinya just I'm going to
Okay.
to stand in front of the monitor to make it like a beautiful photo.
Okay, Ajan.
Soalnya kemarin kecil, Kak. Kak Yaci muncul.
Ternyata rame.
Would you mind to change your background into your beautiful background? Okay, yes, that's good. Okay, about that.
Belum mulai foto.
Okay, can we start the photo session, Ajan? Okay. Pak Denny, silahkan.
Okay, thank you, Mr. Denny. All blessed audience, finally, now we come into the main point in the second online nursing conference, collaboration program between BC and Surin, Thailand and Stikes Hang Tuah Pekanbaru, Indonesia. The topic about nursing care management of patients with chronic kidney disease. We are fortunate to have two prominent and professional speakers today, and we will guide by a moderator to listen about the seminar and discuss more in the question and answer session. It is now my pleasure to introduce the moderator. The moderator of the day is Mr. Nurse Tengku Abdurasid, MCAP. Mr. Rashid is nursing lecturer for emergency and disaster nursing in nursing program of Stikes Hang Tuah Pekanbaru, Indonesia. Mr. Rashid graduate his magister in Pajajaran University, Bandung, Indonesia, specialization of critical care nursing. Okay, for the guest lecture session, please welcome Mr. Rashid. Mr. Rashid, please.
Thanks, MC, for the time. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Sawadika.
Sawadika.
Good afternoon, everyone. I'm so glad to meet you all in this guest lectures today, even from Zoom meeting platform. I'm Rashid, will guide you in the speaker presentation to discussion session. I would like to tell you the rules of the topic presentation and discussion session today. First, topic presentation will be delivered in 30 minutes for both our speakers. And second, discussion session will also be held for 30 minutes. Please the audience mute the microphone and turn on the camera during the event. And then during the topic is delivered, please the audience to prepare question about the topic by posting it on Zoom Messenger or chat with format your college / your name / intended for first or second speakers / question. And then we will choose 2 questions to be answered by each our speaker. So now, I would like to greet our first speaker from BCN Surin, Thailand. Hello, Dr. Sarinya Paulsinchan.
Hello, hello, hello there, and
spelling your name?
yeah, and good afternoon, everyone.
How
Okay,
are you
good
today,
afternoon.
Dr. Sarinya? How are you today, Dr. Sarinya?
I'm doing great, and you?
Yes, me too. So nice for having you today, and I wish you have a good day.
Thanks, thanks.
Okay, well, I will introduce to you the CV of Dr. Sarinya Paulsinchan. Mr. Denny, please to show us the CV of our first speaker. Okay, thank you, Mr. Denny. Dr. Sarinya Paulsinchan got Diploma Nursing Science equivalent to Bachelor of Nursing in Bachelor Science in Nursing from BCN Surin, Thailand. And she got Master Degree of Nursing, concentration in Adult Nursing from Khon Kaen University, Thailand. And she got Doctor of Philosophy, concentration in Holistic Adult Health from the University of Texas at Austin, School of Nursing, USA. Wow, very impressive, very impressive, isn't it? Hope that one day I can continue my doctoral education in the US. And she had professional work experience such as a chair of nursing science program in adult and gerontological nursing until now. And she is committee of curriculum administration until now, and committee of quality assurance and accreditation until now. And she is a nurse instructor in adult and gerontological nursing department at BCN Surin, Thailand. The subjects responsibility are adult nursing, nurse concept, theories and nursing, process, nursing research, anatomy and physiology, ethics and love in nursing profession from 1993 until now. So some of her late experience on training overseas. She joined a training for developing teacher potential in teaching and learning by using PBL at McMaster University, Canada. And she got training in reflective thinking at University of Salford, Manchester. And she also active in conduct research. One of them is health promotion behavior in Thai person with CKD in 2010. And she also active submit her research, her article to journal. Some of them, the integration of completive education concept and problem-based learning method in a select topic of ethics and laws in nursing profession subject for nursing students who publish in nursing journal of the Ministry of Public Health in 2020. So maybe that's all our introducing for Mr. Sarinya. So now Thank you for Mr. Denny. Maybe, okay, well, let's listen to the presentation for Dr. Sarinya Polsinchan with the title, The Role of Nurses in Caring for Patients with Chronic Kidney Disease. Please welcome Dr. Sarinya. Time is yours.
Thank you. Thank you, everyone, for inviting me in this speaking and in this conference. I feel very pleased to be here and to meet all of you, even though it's online, but it's okay because it's a good start for us. That is, we have the conference or we have a meeting together. So this meeting is a good start for our relationship, and because we can learn and we can share our experience. So I love this meeting and I just like willing to join and I happy to. And good afternoon everyone again. So I'm Surinya Ponsinchan, a lecturer from Baromaraja Chonali College of Nursing, Surin. So the topic for today is, I think it's because of the CKD, it's increase in the around the world, and this disease is have many problems. It can cause a lot of problems, including the physical, mental, and social and economics. And also the group of this patient gonna have the problem in quality of life. So the nurses play a vital role in providing nursing care to promote the quality of life. That's why the topic for today that I would like to emphasize is the role of nurses in caring for patients with chronic kidney disease. So I will say it in abbreviation CKD. Okay, it's work. For the outline for today, for my talk. So everyone see my PowerPoint, right?
Not be appear
Not
in
yet.
our screen.
Oh, not yet, right? Oh,
Yeah.
sorry.
Not yet.
Okay, I will figure it out.
Yes, we can see it now.
Right now you can see, right? Okay,
Yes.
great. So for outline, I'm gonna divide my talk into 3 parts. The first one is introduction in CKD, and the second one and the third one is important for nurses that we should know about this. It's how to slow the progression of CKD and the nursing care in CKD. So for the first one, for the CKD, I would like to talk about the definition of it. Because the definition of it is very important because we have to know that if we saw the diagnosis of patient that this one is got CKD. So why is we have to looking for why it's diagnosed with CKD? The CKD is defined as abnormality of kidney structure or function that is present for more than 3 months with implication of health. And either of the following present for more than 3 months, including the albuminuria. So you will see like they have the albumin excretion ratio more than or equal 30 milligram per 24 hours, and albumin to creatinine ratio more than or equal 30 milligram per gram. And also, some might have a urine sediment abnormality. It is hematuria. And have electrolyte and other abnormality due to tubular disorder. Or they will have abnormality detected by histology. or structural abnormality detected by imaging. This one like if we go to X-ray, so will someone is show that the size of the kidney is smaller than normal. So the other definition is they might have a history of kidney transplantation. And for the definition that we can conclude that this one have about the CKD problem is we look at the glomerular filtration rate that we can call GFR. It's lower than 60 ml per minute per 1.73 square meter. So that's why that is about the definition of kidney disease. So it's a chronic one. So we have to look at about the time period that or the problem that they have should more than 3 months that I talked before. And then it's about how we know that what is the progression of the kidney disease, how severe of it. So we can classify, the CKD is classified based on course, GFR category and albuminuria category. This is from KDIGO. The KDIGO is the kidney disease improving global health outcome. That is, they just have the outline or the guideline for this. So this table is show if we look at the GFR category, we will know that which one is the severe or which one is just like start to be a CKD. So it divides into the category is have 5 category, but for the category 3, it's divided into A and B. So you will see that the G1 is the category 1. We look at GFR, it's more than and equal 90. So we can consider that it's normal or high for GFR. For the G2, it's the GFR is 60 to 89. This one is the term is mildly decrease of GFR. So the G1 and G2, it's not too severe to start to have a CKD. But start from G3A, it's the GFR is 45 to 59. This one, the term we call that, this one is in the stage of mildly to moderately decrease of GFR. And for the G3B, it's the GFR, it's 30 to 44. This one is it's getting worse, like in moderately to severely decrease. And the G4, the GFR is 15 to 29. It's severely decrease of the kidney function. And the last one that is that we know that it's called end-stage renal disease. This one, the GFR is less than 15. So this one, it's like a kidney failure. So in the last stage, we have to get like a RRT or renal replacement therapy, such as hemodialysis or peritoneal dialysis in the last stage. So if we look at this category, so we will know that how severe of that person that is what the progression of them or what is we have to give them the nursing care or the advice or education. So we have to look at about this one first. And also the KDIGO have the albuminuria category in CKD also. But in Thailand, we don't have, we use only like estimate GFR to look at like what category that person in. But we don't use like albuminuria in the local hospital. But in the big hospital, they use both to look at the progression of the kidney disease, like to make a better prediction that is gonna getting better or getting worse. For the if we use albuminuria category, it's divided into 3 categories. We have A1, A2, and A3. So this one we use like the albumin excretion rate and albumin to creatinine ratio. So it's a kind like we have divided into 3 term of it. For the A1, if the AER is less than 30 or ACR is less than 3, it's a normal to mildly increase. And for the A2, it's a half 30 to 300 for AER. And for ACR, it's half 3 to 30. It's a moderately increase. And for the last one, it's more than 300 for AER. And for the ACR, it's more than 30 and more than 300. It's severely increased. So this one, if we use the albuminuria category to look at like how severe of the CKD. And I would like to share about in Thailand, the incidence of the CKD. The top 3 causes of the CKD are diabetes, hypertension, and glomerulonephritis. This one is the top 3 causes that make people have the CKD. And diabetes and hypertension cause approximately 70% of CKD cases. So when we take care of person with diabetes or hypertension, so we need to look at like how is their kidney function also, because both of the disease can cause the person has a CKD. And the CKD is a major public health problem around the world. This one, the statistic is around the world. In 2015, the prevalence of CKD was 11 to 13% or 2 million people around the world. So it has a mass of number, right? And in Thailand, for this one is the information from Thailand. 17.5% of Thai suffer from CKD stage 1 to 4, that accounting for more than 8 million people. That one we found all is 8 million people. And stage 3 to 7.5%, followed by stage 2 and stage 1 is 5.6% and 3.3% respectively. This one is information from Thailand. And for the end-stage CKD that I talked before, that is the person have GFR less than 15 cc. On this group, they have to get hemodialysis or peritoneal dialysis. These information in Thailand said that we have more than 70,000 people that have to require for the hemodialysis and PD, peritoneal dialysis. And for Thai government, it's take a responsible for the treatment fee of 10,000 million baht. This one for the number, the unit of money that we use baht per year, that we need to pay a lot of money for patients in this group. And the prevalence of most CKD patients is in the early stages. That is a big problem, because when we see a patient, so in the early stage, the patient doesn't have a sign and symptom. So we don't know that if they don't check about the GFR, we don't know that they have kidney damage already, because no sign and symptom. So the patient think that they okay, they don't have any problem with them. So they might be don't care about how to take care of themselves. So this one is a big problem, because the early stage is no sign and symptom. And most patients not yet known that they have CKD that I told before. And if diagnosed is in the early stage and began to change behavior, it will affect the slowing down of the deterioration of the kidney. This one is the main point that is very important, that if we know that early, so we can promote them or we can help the patient like to slow the progression of the kidney. Because the CKD is cannot be back to be like the normal kidney, right? If they already damaged, so we can stay like stop to at that stage, but we can just reversible back into like the normal one. So that's why this one is we have to pay attention to this point. So I think like for the topic, next topic is very important. It's how to slow the progression of CKD. So nurses have to know like because some might meet the patient in OPD, some might meet in the like in the ward. So we all can meet the CKD patient like everywhere. So we can have or give them an education or how. So I will talk later that what is a nurse should do to help them to get like a better quality of life. So the first one that can slow the progression of CKD is the improved blood pressure control. Because controlling blood pressure is probably the most effective intervention to slow progressive kidney disease. And it's require a combination of antihypertensive medication and lifestyle modification. So the nurse have the role about the lifestyle modification, that how we could help them to change the lifestyle. Because if someone have their habit like for a long time, it's difficult. Because in Thailand, maybe I don't know, like in your country, do you have the problem about like when you teach them that you have to do something like that, 1, 2, 3, 4, 5, but the patients still like don't do that. So this one still is a problem in Thailand because they think that it's okay, they have this habit, so it's not affect to their kidney, so they don't change their lifestyle. And next, we have to use how to lower the blood pressure. We need to use both for the nursing care and for the medication. And for the medication that recommended, it's angiotensin converting enzyme inhibitor and angiotensin receptor blocker that can control blood pressure and to reduce the albuminuria. Some might ask like if you say that control the blood pressure, so what is the number that we have to control it? For the KDI, they say that the targeted blood pressure of CKD patient with urine albumin level is less than 30 milligram per day, or protein to creatinine ratio is less than 150 milligram per gram. We have to control less than 140 and 90 millimeter broad. And patient with urine albumin level more than 30 milligram per day or PCR more than 150 milligram per gram is less than 130/80 millimeter broad. This one is also we have the Nephrology Society of Thailand. We use a guideline. This one as the same with US and another that use this guideline also. And then except from the controlling the blood pressure, the blood glucose control, it's very important one too for patient with diabetes with a target, that for the target hemoglobin A1C, we have to control it approximately 7%. The next one is nursing care in CKD. Because the three main nursing care goals are prevent or slow disease progression, the first one, and the second one is to promote physical and psychosocial well-being. And the last one is to monitor disease and treatment complication. So I will go with the first one. To prevent or slow disease progression, it's to collaborate with patient and provider to target modifiable risk factor, especially specifically focusing on diabetes and hypertension management to keep glucose level and blood pressure reading within appropriate target ranks. This one I already talked before. That is, what is the number that we have to keep in the rank that is the good one. And next is the cell management techniques. So I will talk it later that it's very important for nurses that we have to help the patient to do self-management because this CKD is a chronic one. So it's still with the patient until they die. So they have to know how to manage themselves like properly. So this one is very important one. And also the medication therapy guide management that we have to use like at the same time together. And to encourage patients to perceive the self-efficacy in self-care assessment, analyzing, planning, making decision in action, and taking action according to the planning and assessing the result after practice. Because the patient, if they perceive that they have self-efficacy, so they will have confidence to take care of themselves. But if they feel that they don't know or they lack of knowledge to take care of themselves, they cannot do that. So the nurses choose encourage people to perceive like they have self-efficacy to take care of themselves. And also the psychological support using empowerment so that patient having confidence that I talked before. So nurse again have to empower our patient and also the provider that stay, the caregiver that stay with the patient to have the empower to take care or empower to change the lifestyle. It has when we gonna help them to have more confidence in self-management, we can assess patient self-management ability before and after educational session. So most of us use like a educational session to help them have the skill in self-management. Or someone might set like a program that to help the patient to have ability to take care of themselves. First, you have to assess patient like what is self-management ability by asking the question like how is your physical and or emotional health? Or what are you worried or what concern you most? And what important for you to achieve? What are your priorities? What would improve your quality of life and well-being? How are you and your loved one handling your illness? This one is the question that you will assess that what is the self-efficacy that the patient have from the answer that they answer to us. Okay. So and this picture is it's a handbook that is everyone can enter or use by go into World Wide Web nephrotype.org. So this one is a clinical guideline that to take care of patient with CKD. So if we have a problem, we can go like online or search for the how we could do, how nurse or the healthcare personnel have to do to help the patient coping with this disease or to do like a lifestyle modification. So we use this one in Thailand. And for the self management that I talked before, like this one is very important one to help the patient to have the confidence in themselves. The first one is we have to teach them or let them know that they have to maintaining a healthy weight is the key to CKD self management. By achieve a healthy weight is the body mass index. It's 20 to 25 because the research show that for the one that is overweight or malnourished, patient is cause of chronic infection and result in anemia of CKD patient. So we have to try to help them to stay like have a healthy weight around this one. And CKD patient should take physical activity because some might think that, oh, because I'm a sick person, so it's not necessary for us to take a physical activity, but it's wrong because the CKD patient should take physical activity like the normal person do and aiming for at least 30 minutes or 5 times per week. So this one is very important one because the evidence show that exercise help stimulate the bone marrow. So it helps to increase the amount of blood cell and hemoglobin level. And also the exercise help strengthen the muscle and increase the ability of physical function and also stimulate the immune system and reduce the production of inflammatory substance. See, it's a lot of problem of physical activity or exercise. So we have to encourage patients to do that. And then this one is the big problem in Thailand. It's about dietary modification because the patient they feel that they eat the same way that they like because they don't change and it's very difficult to change because when we ask them why they said because if they change about the taste of the food maybe they cannot eat, they eat less, so they say they still like stay in the same level of the seasoning that they use because the recommendations say that the lowering protein intake to 0.8 gram per kilo per day in adult with diabetes or without diabetes and GFR less than 30 cc per minute. With appropriate education, this one we have to lowering the protein intake in this group of person. And we have to encourage patients to eat a variety of food that are fresh, lean, low fat, low sugar, and low cholesterol. And then this one is the big part of problem, the lowering salt intake to less than 90 millimole or less than 2 grams per day. And this one is the technique. If you want to help them to lower salt intake, maybe it's some tip that you can suggest them. The first one is maybe it's your the patient testing have to test food before adding seasoning and avoid fermented food because in Thailand we have a lot of food that is fermented. For example, I don't know like in your country you have a lot of fermented food or not because you can share in this point. And because we have the fermented fish, the pickled crab, the salted fish, and the preserved fruit or salted egg. So this one is can cause more sodium or a lot of salt intake if we like to eat this food. And another tip is adding seasoning only half of them used to feel normally. So we have to educate patient try to lower the salt intake. And do not place the condiment on the dining table because if you saw it, right, if you see it that, oh, it has the season, so you will grab it and to add it in your food. So do not place the condiment on the dining table. It's another tip. And then read the food label before purchasing, especially the amount of nutrients or amount of sodium that is like a high or low, and should add other flavor instead. For example, spicy, sour instead of like salty. So this one just like a tip that if you want to uh, convince or help them to lower the salt intake. And then this one, the individual with CKD have to receive expert dietary advice and information in the context of an educational program tailored to severity of CKD and the need to intervene on salt, phosphate, potassium, and protein intake. Because I just talk about the salt and protein, but in some cases they have a high phosphatemia too. It's high phosphate and the high potassium. If the state of the CKD is in the 3 state or 4 state, this one is you gonna the patient gonna have a problem about the electrolyte imbalance, about the phosphate and potassium also. So it depends on the state of CKD that you meet. So if they have a problem, not just only salt or protein intake, so you have to consider about the phosphate and potassium as well. Next is the patient should avoid alcohol and nephrotoxin because this one can has a reabsorption of sodium and water overload in the body. So it can cause a problem about hypertension later. And cigarette smoking, it's we need to teach them you have to stop smoking because it's associated with abnormal urine albumin and progression of CKD. And also smoking, it's also contribute to death from stroke and heart attack in people with CKD. And the statistics show that 14 to 60 times of CKD patients likely to die from cardiovascular disease more than end-stage renal disease. So this is why we have to suggest them to have a smoking cessation. And we have to educate patients about how to protect themselves from injury and infection. Because when patients have infection, when infected, the cytokine is released into the bloodstream, which had an effect to inhibit iron absorption, resulting in the body having iron deficiency and cause anemia. And also the cytokine is suppress the production of erythropoietin hormone and shorten the lifespan of the hormone. So it causes anemia in patients with infection. So in CKD, patients should take care of themselves strictly to keeping the body clean, stay healthy, exercise, wear a surgical mask, and avoid to stay in crowded places. So we have to teach patients how to recognize signs and symptoms of infection and to report them to healthcare provider also. And provide the patient-specific education such as the overview of CKD, treatment, and cell management technique. So this is why I'm gonna share the list of attribute of effective self-management intervention and system support. The evidence said that some may use the technique about the follow-up call because you're gonna know that is what is their lifestyle. It's they change or not change by do a follow-up call, or you might use a strategy about the nurse case management. And also the patient empowerment is very important one too. So nurses can be coach or support the patient or provide a group empowerment session for them too to empowerment them. And the collaborative goal setting and problem solving is a important one also because if the goal setting is come from nurses because the patient don't realize that it's not their goal because it's the nurse goal. So you have to collaborate with the patient like what is your goal setting and what is your skill to do a problem solving. If you if the patient doesn't have more skill, we have to teach them or help them to have a skill to take care of themselves. So to take care of the CKD patient, it's gonna work if we use like the multidisciplinary team together, not just only nurses, but we need to have a team. And patient and the caregiver is one of the important team. So they have to know or they have to plan or talk to them together, before we want to do something with them. So we need to ask what is the opinion from the patient, from the caregiver, and we plan together. So it's a self-management. It's going to be effective in this. And some might ask that the patient education session, we have to think about it also if we want to teach our patients. So we have to decide we have to teach them individually or we have to teach them in a group. So you have to decide. And you have to teach them how many times, one time or periodic or several times. And how long for the courses that you want to teach them. If the short-term courses is 4 to 6 sessions, or you want to be a long-term courses like 6 to 12 months. So this one you have to decide the program if you want to help them to have a self-management skill or you want to help them like to empower them or to persuade them like to take care of themselves. And the material also, the educational material is important one. You have to think about which material that you're going to use. It's audio visual or electronic, the internet. Yeah. So this one, it have to fit with your patient. Okay. And the overview of CKD, this one, it should include information about normal kidney function, common causes and risk factor, diagnosing, testing, staging, symptom, and complication. This one have to add in your information that the patient have to know too, because if you want them to take care of themselves effectively, they have to know all of this and they have to plan it to have a goal so they can follow the plan and they can evaluate that the plan is work or not. If it doesn't work, how should they do that next? Okay. And to promote the physical and psychosocial well-being, it's important also because the patient with CKD are at risk for many psychosocial issues such as anxiety, depression, and stress because this disease is cause them a lot of problems, both physical and mental. Maybe it's not two of this, but maybe the social, they cannot go to have the socialization or they have a problem about their economic. So this one cause them has a psychosocial problem. So we how to assess the patient's psychosocial status and coping mechanism and help them identify strategies, resources, and intervention to support their well-being. And we have to help deliver treatment by assessing, planning, implementing, and evaluating care plan. This one is a nursing process that we use all the time to help the patient and to help them and start from the first process until the evaluation. And we can change the plan if it doesn't work. So we have to think about what factor that cause them, or it's a problem that is an obstacle that make them have a successful to take care of themselves. For to monitor disease and treatment complication, we have to pay attention if your patient is experiencing fluid overload. You may need to carry out provider order that include applying fluid restriction and or administer diuretic medication too. And electrolyte imbalance may require dietary change and or medication administration. So we come to the end of this talk. For the takeaway message is understand. So nurse have to understand how to prevent or slow disease progression. So it's a lifestyle modification, self-management education that I talked before, and the skill that is important. Skill of providing patient education and monitoring the disease and its treatment. Because if we have a skill or providing patient education, so we're going to know that which point is very important, because we cannot teach them a whole bunch of knowledge, right? Because it's too much for them. So the nurse should know which topic it's important for them, and we help them, we guide them, you show them how to do that. And with that knowledge and confidence, if our nurses have a knowledge and confidence, so you can promote patient physical and psychosocial well-being to help ensure the quality of life of them. Okay, so that's all for my presentation for today, and thank you very much for your attention. Okay, thank you.
You're welcome, Dr. Sarinya. Kapun kap, Ajan.
Yeah, thank you.
Thanks for sharing valuable knowledge and experience with us. Hopefully, we can take the important point from the knowledge that you deliver. As you said before, it's really hard to diagnose patient CKD patient in early stage, right? So for the patient with high risk, maybe we can give our attention to give them health promotion to prevent them fall in CKD. I think it. Okay, thank you for Dr. Sarinya. And then before we are listening to second presentation, I want to apologize to all of you that our second speaker should be Mrs. Rani Lisa Indra MCAP SPCAP MB. However, she is currently being treated in hospital after childbearing. Let's pray that she and her baby will always be in good health.
Amen.
So, currently, our second speaker replaced by Nurse Sandra MCAP SPCAP MB. I would like to greet our second speaker from Stikers Hang Tuah, Pekanbaru, Indonesia. Hello, Mrs. Sandra.
Hello, Mr. Rashid.
How are you today?
Fine.
Okay,
I'm
so
fine,
nice.
thank you.
Thank you for your opportunity and your willingness to replace Mr. Rani as the second speaker today. Thank you
Okay.
very much. I hope you enjoy the event. All right.
Bismillah.
My pleasure to introduce to you all the CV of Mrs. Sandra. Mr. Denny, please show us the CV, please. Hello, Mr. Denny, our IT team. Mr. Denny bisa tampilkan CV Bu Sandra. Hello, Mr. Denny. Okay, she is sharing now. Okay. Okay, I would like to introduce to you our second speaker. He is Mrs. Sandra. She is Mrs. Sandra, MCAP SPCAP MB. Mrs. Sandra got diploma degree of nursing in Muhammadiyah University Pekanbaru, Riau, Indonesia, and she got bachelor degree of nursing and professional in Riau University Pekanbaru, Indonesia, and she got master degree of nursing and medical surgical nursing specialist from University of Indonesia, Depok, West Java, Indonesia. And she also active in research. Some of them application of listening to Fajr Surah and its translation on the state and trait anxiety before elective digestive surgeries in 2020. And her work experience, she was a head of nursing in medical surgical ward in Ibnu Sina Islamic Hospital, private hospital in Pekanbaru until 2008. And she was head of nursing division in Sansani Hospital Pekanbaru until 2012. And she was a clinical instructor for nursing student in Arifin Ahmad General Hospital until 2014. And she now lecture at Stikes Hang Tuah Pekanbaru nursing program until now. Okay. For our audience, I would like to remind you that during the topic is delivered, please to prepare the question by posting it in the Zoom or Zoom chat or Messenger by format college / your name / intended for first or second speaker / question. We will choose some question to be answered in discussion session. Now let's listen to the presentation from Mrs. Sandra with the title Fluid Management in CKD Patient. Please welcome Mrs. Sandra. Time is yours.
Thank you, Mr. Rasid. Assalamualaikum warahmatullahi wabarakatuh. Sawadika, Dr. Sarinya. Nice to meet you. Good afternoon for everyone. I would like to say thank you for your for coming to my presentation. It's great to see you all. Okay, ladies and gentlemen, let me introduce myself. My name is Sandra. I'm lecturer in medical surgical nursing, and thank you for moderator who helped me read my curriculum vitae. Okay, our topic today is fluid management in chronic kidney disease. Please let me presenting my slide today. Next, I will share my presentation slide. Wait a minute. Okay. Can you see my slide, moderator?
Yes, we can see it.
Okay. I want to slideshow now. Okay. Okay. Fluid management in chronic kidney disease with me, Sandra. And now we can introduce introduction related to what is delivered by Dr. Sarinya before about chronic kidney disease involves progressive irreversible loss of kidney function. Controlling fluid intake is one of the main problems for dialysis patients because under normal condition, human cannot last longer without fluid intake compared to food. Chronic kidney disease sufferers should control fluid intake to improve quality of life. Most clients who are undergoing a hemodialysis therapy in Indonesia every 2 times per week and therapy for 4 to 5 hours. That means the body has to bear excess fluid between 2 dialysis time. The indicator to determine the amount of fluid intake and salt during interdialytic period and the patient compliance with fluid management called interdialytic weight gain, or we can call IDWG. Okay, next slide. Interdialytic weight gain can be an indicator of a patient fluid intake during an interdialytic period, can affect the health status of the patient during hemodialysis therapy. IDWG is an indicator of patient adherence to fluid regulation. In a patient with good compliance with fluid management, the IDWG does not exceed 2 kg or 3% of the dry weight. So IDWG measured based on the patient dry weight as well as from measurement patient clinical condition. So that's we call dry body weight is the body weight without excess fluid formed after hemodialysis, or the lowest safe weight is reached patient after dialysis. Okay, we can continue. IDWG was classified into 3 groups. Okay, like light, and then moderate, high. So we can like if weight gain less than 4%, and moderate if weight gain 4 to 6%, and high if weight gain more than 6%. The patient body weight was weighed routinely before and after hemodialysis. IDWG was calculated as pre-dialysis body weight minus the post-dialysis body weight of the previous hemodialysis session. Okay, this the patient body weight was weighed routinely before and after hemodialysis. For example, the body weight of the first post hemodialysis patient is 54 kg. The weight of the second hemodialysis patient is 58 kg. The percentage of IDWG, quantity 58 minus 54 divided by 58 multiplied by 100% is 6.8%. Like that calculated. For example, okay, since body weight may influence nutritional and fluid intake, the results are also shown for IDWG as a percentage of dry body weight. Because dry body weight is clinically defined as the body weight as which the patient remains normotensive without antihypertensive medication. Okay, how high IDWG? The increase in IDWG can be caused by various factors like internal factor and then external factor. In internal factor include age, gender, education level, thirst, stress, self-efficacy, and external factor like namely family and social support and the amount of fluid intake. Let I explain you about age. Age increased IDWG value can be happen at any age. This thing deals with the compliance fluid intake regulation, but based on research result and several literature that the increasing at age will be causing change in functional structure. And then we can look gender. Men are at risk CKD, I mean, compared to women. This matter because women have hormones more estrogen. You know, the hormone estrogen can affect calcium level in body by inhibiting formation certain cytokine to inhibit osteoclast. You know, osteoclast calcium has a protective effect by preventing the absorption of the oxalate can form kidney stone, which is one of the causes of CKD. If he, sorry, this factor, if we not help our patient for poor management of fluid restriction, the calculation of high IDWG. Okay, next, fluid management. Fluid management skill in identifying problem, setting goal, problem solving, decision making in response to fluctuating sign and symptom, taking action in response to the physiological response to body fluid deficiency, monitoring and managing symptom. Fluid management greatly influence the calculation of IDWG. So how fluid restriction? Fluid restriction are focused on two dimensions, like reduce salt intake and control fluid intake. You know, CKD patient urinate no more than 200 to 300 milliliter daily. Hence, patients are advised liquid not more than 500 milliliter or the equivalent of 2 glass per day. Fluid restriction must be done to adjust fluid intake with renal tolerance in regulation. The recommended fluid intake depends on in amount of urine 24 hours, namely the amount of urine 24 hours previously added 500 to 800 cc per day. Okay, next slide. How about role of nurse? The role of nurse this case are to educate patient or family regarding fluid intake and output, salt consumption, fluid needs, helping to enhance self-efficacy in fluid managing, to improve patient compliance to treatment regimen. For tracking fluid, okay, and then providing specific individualized fluid goals, and then managing thirst and limiting excessive sodium intake and adjusting dialysis regimen to meet patient needs. Okay, tracking fluid intake and wake. We can write down the fluid intake in small notebook. Include liquid with meals, snacks, and medication. Use a water bottle that is marked with daily liquid goal in ounce or milliliter. Measure fluid amounts to ensure correct portion size. Talk to the doctor and dietitian about the specific weight and fluid restriction goal. And last, use a small glass to drink. Okay. Okay, let's see a picture, but fluid balance record. This is explained about monitoring can be done by using an intake and output chart that contains detail of the amount of fluid intake and urine output every hours. In urine intake and output within 24 hours are then calculated to determine the fluid balance, like client hydration status, and determine the amount of fluid that is safe for the client to drink for the next day. Calculate fluid of like monitoring water weight. This is using a fluid intake output chart, requiring the nurse knowledge of the patient condition and history, careful examination and observation of the nurse, and understanding of the result of special examination regarding fluid balance. The chart used by nurse is the one that meet the standard, like this, consisting of name and then medical record number, intake and output added up after 24 hours of monitoring using a measuring instrument for fluid intake and or urine output. Okay, let's see the right picture fluid balance record. They're monitoring water weight. It's explained that keep a daily log of your weight, use the washroom, and do not eat before weighing yourself. And then weigh yourself every day using the same scale and weigh yourself at the same time every morning. So this method requires patient or family cooperation. Okay. How to controlling thirst? Okay, controlling thirst, avoid foods high in salt that cause increased thirst and blood pressure. How to be control sugar intake, as too much sugar and high blood sugar increase thirst. And then suck out frozen fruit such as blueberries and grapes, limit to half cup serving. And then chew gum or suck on hard candy, often gargle, but don't swallow the water used to rinse. And then if the patient have a dry mouth, you can educate about use a spray bottle to moisten the mouth. And then sucking ice scoop temporarily relieves thirst, but may increase the water intake if used very often. Okay, and next slide. To reducing salt in your diet, we can educate our patient about begin reading food labels as a matter of course, and then use fresh rather than packaged food, and then don't buy low sodium salt and use salt-free bread, to pinch of salt in a day, better on just cook foods. And you can substitute in the kitchen and the dinner table spice and herb for salt. Okay, limit salt intake. I explained that enough for my presentation. Thank you so much for all the lecturer and students who are very excited today, very excited. Yeah, thank you for all your questions, and maybe for didn't answer at all. I'm sorry for my bad English and pronunciation, for all my mistake. Sorry, yeah, when I explain the topic in slide. Yeah, and thank you for all your attention. I'm Sandra. Goodbye, everyone. Sawadika. Okay. I'm returned to Mr. Rashid, and please, moderator, and then I close my screen sharing now. Okay, stop sharing.
Okay, thank you, Mrs. Sandra, for presenting the important topic about fluid management. All right, now we are going to the discussion session. thanks to our audience who have posed the good question. I apologize that can be accommodate all the question to be answered due to time limitation. Okay, first question is intended to Dr. Sarinya. Okay. Dr. Sarinya?
Yes.
The question is how to control infection during the patient get a CAPD, peritoneal dialysis in Thailand. Control the infection.
Okay, for the peritoneal dialysis in Thailand, we're gonna have a session to teach the patient like for 2 weeks, you know, before we try to do a peritoneal dialysis, we're gonna have patient with the caregiver, you know, to come to the nurse session that we're gonna teach them about the information about the kidneys, you know. Then we're gonna teach them about how to do that. This one is including CAPD, the continuous peritoneal dialysis also. Yes, and we just like include the caregiver also why we teach them. So we're gonna ask the caregiver to take care of the patient or help them to see or to warn them like which one this can get the infection. For example, when they wash their hand, something like that, you know. So they are the other step to do why they change the bag of dialysis. So every step like we try to show them. We have a video also, you know, why we teach them, and also the environment is very important one. So we have to prepare the environment why they change why they change the fluid or why they exchange the peritoneal dialysis. So the environment or the knowledge of the patient and the caregiver. And so we have the hotline, the call. If the patient or the caregiver have a problem or when they're not sure like what they're gonna do or they're not sure, so they can call us. They call nurse, you know, call nurse to ask like how should they do. They call hotline, and also we give them a brochure like the way to do the step by step. So this one, the whole thing that we do, so maybe can protect the infection, and we teach them how to observe the sign and symptom if like they have the sign and symptom of the catheter, something like that, or the fluid that is changed. So they're gonna know which one that they can call or come to see the doctor. So that's all.
Okay, thank you for your answer, Dr. Sarinya. And then we are going to second question for you, Dr. Sarinya.
Okay.
How nurses give motivation for CKD patient or family member to to prevent disease progression in Thailand?
Again, please.
Okay. How nurses give motivation for CKD or family member of patient to prevent disease progression in Thailand?
Okay, so we have a lot of program, you know. So because the patient has to go back into the community, right? Because they live in the community. So we have the network also. So the nurse in the hospital have a network with the nurse that work in community. So we're gonna share or refer the information to that community that what is the problem or what is the stage of the disease to the nurse in community. So the nurse community has a duty to come to visit the patient and the caregiver in their home, and we can like check up their body and teach them or like show them or empower them like how to do like a lifestyle modification and let them ask the question. Yeah, so we have a network, and also we have like a package or handbook package that yeah, we can give it to them. So it's if they have a problem or they're not sure about or how they're gonna do, so maybe they can contact, because the nurse in community is stay close with them, you know, because they have to take a responsibility. But if the nurse in the community doesn't know, they're gonna consult like the nurse in the hospital again. It's a network too. Yeah.
Okay, thank you, Dr. Sarinya, for the answer. Maybe the audience can take a critical point from what Dr. Sarinya said. And then we goes to question for our second speaker, Mrs. Sandra. You can hear me, Mrs. Sandra?
Okay.
Okay.
I can hear you.
Okay. Maybe it's out of context, I think. But and the question is, in the emergency case for CKD patient.
So, can you repeat again?
What is the best side to puncture of patient bloodstream to do hemodialysis? Okay. Can you understand what I say? Maybe I would like to repeat again.
Okay, no. Thank you, Anissa.
Okay, in the case of urgent or emergency hemodialysis, where the atrioventricular taken place.
Okay. Maybe I can minta tolong itu apa help to Dr. Sarinya to lebih answer to lebih lengkap itu expertise. Okay, I try to answer is apa namanya expression about in an emergency situation, arterial access that can be done is to stay through the large and easily accessible arteries. So namely the radial and femoral arteries. So that's my answer.
Okay,
How
Mrs.
about
Sandra?
my answer?
Thank you for the answer. Maybe it's out of context, I think. Okay. Okay, maybe that's all our event today.
Maybe moderator, maybe Dr. Sarinya
okay. Thank you.
Answer. Okay.
Okay, thank you for reminding me. Okay, Dr. Sarinya, when the emergency case and the patient should take hemodialysis, so where is the site for arteriovenola taken place?
So it depends, you know. It's not just like the nurse take that decision, because it has to be a physician too, you know,
yes,
to decide which that they're gonna do that, you know. So we have from theory, we have many places that we can do to like the AV fistula, right? the femoral, some
Femoral.
some kind like that.
Femoral.
If the patient have the ulcer or cannot do at that place, we're gonna change it to another place. So yeah, it depends, you know, not just exactly like a which side that is very good or very bad. But the famous one is the AV fistula. Yeah.
Okay, thank you, Dr.
Thank
Sarinya,
you,
for the
Dr.
answer.
Farida.
Okay, all right. Maybe now we are. Mana tadi ya? Okay, thank you for your response and answer to audience question. All questions were good question, and I hope that audience can accept and understand the answer to each question. And then conclusion of our discussion today, nurses are expected to increase their competence in fulfilling the patient needs, CKD patient needs, and increase patient and family participation in care to improve patient's quality of life. For my dearest audience, please fill your attendance and feedback toward this event on the link that has shared before in the Zoom Messenger. Your feedback is very helpful for improvement in the next similar event. All right, that's all our discussion session today. I would like to say thanks to our great speaker for sharing knowledge, and I salute to the audience who have remained faithful in the topic presentation until discussion session. I hope this pandemic will end soon and we can return to our normal activities. Thanks to BC Ansurin for participating as guest lecturers today at Stikers Hang Tuah Pekanbaru, Indonesia. I hope we can hold a similar event in the next year. Hopefully, we can always strengthen our friendship and partnership for the future. I also would like to thanks to all committee for your cooperation. Maybe thank you for your attention. Assalamualaikum, sawadika, good afternoon.
Sawadika.
Good afternoon.
Good
Thank you
afternoon,
very much,
sir.
Ajan.
Thank you very much, Ajan Sarinya.
Thank
Thank you, Mrs.
you.
Sandra.
Yeah.
Okay, I will
Thank you.
return it back to the MC.
Okay, thank you, Mr. Rashid. Ladies and gentlemen, those are the agendas we have presented to you today as we have finished our second online nursing conference. As the master of ceremony, we would like to thank you to all the speakers, the committee, and the audiences entirely. Thank you for making in the time in your busy schedule to join us here. We wish you all a pleasant day, and for the student, we hope the lesson from the speaker will improve your comprehension learning in medical surgical nursing. Finally, it's time for me to end the event today. See you in the third online nursing conference on December 21st, 2020. Let's close our event for today by saying Hamdalah. Thank you very much. Kapungka. Assalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi
Kabunka. Thank you. See you on Monday.
See you on Monday,
Ajan.
Ajan.
See
Thank
you
you,
soon,
Ajan
Monday.
Solara.
Thank you, Ajan.
Thank you.
Ajan Sarina.
Thank you so much.
Thank you
See
so
you.
much.
Thank you.
Good afternoon.
Good afternoon.
Untuk peserta mahasiswa Hang Tua, tolong diisi link absen di chat ya. Di kolom chat atau nanti akan dikirim lagi ke WA grup komting masing-masing. Terima kasih atas kehadirannya. Sampai jumpa di hari ketiga, tanggal 21 hari Senin jam 2 juga. Untuk keperawatan maternitas. Terima kasih semua yang sudah hadir di Zoom dan panitia. Alhamdulillah. Ya, silakan boleh live. Jangan lupa isi absen ya.